questions?
Hi, sorry, I keep feeling like I keep having questions. But the quick question for Shannon, for the students on campus who have mental health conditions, are you, in addition to trying to connect them with health, are you trying to connect them with your disabilities office so they have appropriate accommodations in the classroom?
Absolutely. The disability resources for students on campus is one of our essential partners. That's so often there's so many, offices, students get overwhelmed with knowing where to go. So we make sure we sort of eliminate all the noise and make sure that they get that direct connection. So we'll set them up if appropriate with our disabilities resources for students. Absolutely.
Great, thank you.
Yeah.
Hello, thank you so much. That was a really great presentation. Ms. Bailey, I have a lot of comments for yours, but I'm going to save it. No, I'm going to save it for the young adult panel because I could go on. I think that's a really amazing topic and it's very important. Dr. Schneider, I actually have a question for you. One of the things that you mentioned was really being careful about lumping that 19 to 24-year-old age because they're very different. A 19-year-old may still be in college and a 24-year-old is out in the working world.
Or could still be in college.
Or could still be in college, absolutely. And I guess my question is just about, for some of this research, resources are a big problem. And if we're going to split up that age group, what do you see as being some of the ways to overcome barriers such as financial resources to really study these populations? So I'm just looking for some info on that.
Well, I wish I was in charge of research dollars in the federal government and a lot of other places, but I'm not. But I feel that if we're going to make a difference in the health and well-being of young adults, we have to pay closer attention. And I think that a lot of that has to do with diagnostic procedures and looking at people of where they are. So we have to get away from just the idea that it's an age bracket, and we have to really focus on their status and then get some sort of, you find out about their age, you find out about where they are, and then you give some sort of a treatment on the basis of those factors. I don't know how to get the resources, but I feel that the evidence for the case is overwhelming. And I would challenge the people in this room that presented graphs of 19 to 24-year-olds to go back and try and, break those out by 19 to, 20, and then look at them by subgroups, men, women, and of course by social class, because no one here has really dealt with the issue of social class, let alone race and ethnicity.
Thank you.
Cameron Ritchie here. We're going to be talking about the military after lunch, so I won't steal our own thunder. But in the context of the community colleges, I would like to highlight that often veterans are returning to the community colleges, and I think they're their own subset of people who really struggle. They've been given a lot of money under the GI Bill. Often college is a logical place for them to go. A lot of the schools are setting up veterans mentorship programs, and that's helping, but it's not uniform across the board. So I'd just like to have a special point that veterans are their own subset, and we can do a lot more to assist them getting through.
I really like that point because we have a proposal right now that we've been trying to get funded to look at exactly that issue. Because one of the problems with the veterans is that we make certain kinds of assumptions about when they are returning. Lots of times we don't look at the conditions around their lives. And the second thing is we really don't pay enough attention to their subjective well-being. So very oftentimes we don't have the right kinds of instruments to identify when their anxiety levels are going up, when they might feel unease in a certain kind of a situation. And as long as we kind of use these survey measures that give you just a one-time kind of indicator, we're really going to be in a lot of trouble. We have to get more momentary kinds of analyses by which we understand how people's emotional changes occur over time.
And I also wanted to add that and say that I know that the veteran issue is also closely related to something that Barbara wasn't able to talk about today, which is the problems associated with for-profit colleges.
Larry Steinberg from Temple University. This is mainly directed toward Barbara, but also Rob may have some thoughts about it as well. Across a lot of the presentations yesterday and today, there I think is some frustration in the way that age categories are defined, and I'm wondering if we can just do a little thinking about how official statistics ought to be broken down into age categories that might make more sense given our understanding of this period of time?
Well, I actually think it's a status that we ought to focus on status. We ought to focus on where people are. And then age becomes one of those demographic factors that we put into the equation, much like we do, gender and everything else. That the most important thing, at least in my mind, is to try to contextualize where that person is at that particular time. For this presentation, I wanted to do something on college completion rates. Well, I only work with longitudinal data. There are no longitudinal data on college completion rates for those people that started in 2008. So I have no numbers to show you on that. So to me, one is that we have to start making sure that we're getting better indicators of particular contextual situations as they're occurring. So freshman 2008, then you can say, well, what's your age, what's your nativity, et cetera. But unless we move to that, I just don't quite see how this is going to work.
I feel like I'm much better at criticizing people for how they age group think. Once you actually think about it, when you have to sit down and write about it, you realize how difficult it is to come up with meaningful categories for this particular decade, 18 to 28, maybe. It's unlike other ages. It's just very hard to decompose because the statuses mean so many things. I think a perfect example of that is about work outcomes. Income for 20-year-olds looks much better for people who don't go to school than they do, but that's meaningless, right? And so we should have actually had maybe we should have organized a discussion section at the end just about the age issue, because we certainly, as the planning committee, dealt with it a lot. Right. Wait, just a second, Rand. Are there any web? Okay, go, Rand.
Rand Conger, University of California, Davis. This is more of a comment than a question, although certainly people on the panel might want to respond to it. It seems to me there's some very fundamental shifts going on in the United States that underlie a lot of what we've been talking about, the forgotten half, the unique nature sometimes of kids who go on to college. Right now, in almost all states, going to college is more and more a benefit of the advantaged. It's becoming harder and harder for just normal folks to go on to college and support it on their own. We talk about the Great Recession as creating economic problems, and yet for the last 2 decades at least, incomes have been flat for by far the majority of people in the United States, and going down for many who started out in not such good shape to begin with. Social mobility in the United States is now social mobility in the sense of going from being disadvantaged as a youth to being in a more advantaged position as an adult has been going down. There are now European countries, which we usually look down on as really not advancing social mobility. Many European countries have greater social mobility now than we do here in the United States. And our income curve is beginning to look like Latin America 50 years ago, where we have the very rich and we have those who don't do so well. And in an environment like that, where the economic scenario is really not very good at all for by far the majority of people in the society, we may have to rethink entirely how we think about young adulthood. You add on top of that the notion of meritocracy, that is that the very smartest who are able to work best in a highly technological world. These young adults now, meritocracy and globalization, these young adults now, they're not moving into a situation where they're competing just with other Americans. They're competing with people all over the world, people from Southeast Asia, many of whom, in our new efforts to revise immigration, will be coming to the United States in greater numbers, because in addition to trying to deal with issues around Latin America and Mexico and so on when it comes to immigration, notice that the well-to-do, the big corporations, would like also to open up greater influx of the very technologically advanced kind of folk they can get from around the world. So our young adults today are facing a situation that young adults in the past, certainly 20, 30, 40 years in the past, just didn't have to face. Our notions about family relationships, I believe, will need to change, because more and more of these folks are going to stay together, not only because with their families of origin for longer periods of time, not just because they themselves can't get a break, but because their parents can't get a break. But I think a lot of those changes underlie many of the comments that have gone on yesterday and today. And I just hope that as this report or as this workshop comes up with some conclusions, we keep in mind some of these broader changes that are occurring.
Mm-hmm.
Trina Anglin. This question is more concrete and switches gears a little bit. It's directed largely towards Shannon. I'm wondering whether you're aware of evaluation data and the experiences of colleges and universities that in some way have attempted either to structure or to limit the use of alcohol by students.
I'm not aware of the data of specifically how they've structured limiting the use, but I do know, so largely what I'm aware of is the research around what's effective in sort of addressing, for example, what's the best way to disseminate information about alcohol use? Jason at our university does a lot of, we don't do the just say no, or we're not into sort of the game of limiting it, because we know that really doesn't work. But what we do know is if you give students the information about their own use, so how to, what their own limits are, and sort of have them come up with consequences. What do they like about drinking? What do they don't like? It's amazing, sort of those brief interventions, those responses that the students elicit themselves, and they start to then sort of come up with their own strategies for reducing their own drinking, again, much similar to that basics sort of model. And so we know that that's effective. So we really sort of put our money into those resources. We work, Seattle is we have, it's right in the middle of a very urban metropolitan area. We have a lot of bars around, as most college towns do. And so we definitely work with our community around responsible, sort of the businesses, responsible advertising and that. But we don't go so far as to ban it. That isn't something we've typically done.
Okay, this will be the last question. So.
Yeah, so my question is, again, looking at changes that are happening, maybe a little more concrete. The demographics are changing. The people who are going to colleges are changing in many ways. There's more females. It's going to be much more diverse just because of demographic numbers as time goes on. And with those changes, and different people wanting different things, people wanting their families more or less involved than they have been, the kind of people that are going now. And how, and I'm Leslie Walker from University of Washington. I'm also there, so I see a lot of the kids from that university. There's a culture change that needs to happen with colleges, with our whole country probably, but definitely with colleges. And how much has been invested in looking at, we all know who the party schools are. I mean, it's rated, you can look on any, find out, where is there any kind of energy to change the culture? Because we can make a difference if we change the culture and what people expect when they go to college. And people go to party schools because that's what they expect. People go to schools that aren't like that because that's what they're looking for. So how can we actually be more positively promoting some of the other attributes of college and really change the culture around alcohol, drug use, and that kind of party?
It's a large question. I can just start with a brief response in that in a lot of the education we provide, we talk about the percentage of students who actually don't drink on campus, and they're usually shocked that 30% of students haven't drank within the last month, or whatever statistic we're sort of laying out for them. They usually laugh and go, "Really?" And we're saying, "No, these are the University of Washington statistics." And so I think a little bit of norming about what really goes on in higher education goes a long ways. I also think that again, it's a cultural thing. We can't do it alone as a university. healthy. We're just one particular, avenue. But I think also the culture around drinking. I mean, it's a huge advertising industry, and there's a lot of promoting sort of the partying lifestyle. And so there's multiple ways that we can address it. But I think on our college campuses, we obviously promote, events and activities that don't involve alcohol. That's not our focus. And alcohol isn't allowed. So getting back to the question about banning alcohol, I mean, our events typically are not alcohol, don't involve alcohol, but so they're usually not the focus, and we make sure we provide alternate sort of education.
I raised the Academically Adrift book because it definitely changed the conversation whether or not you agree with the findings. And the emphasis today really is on looking at colleges and what's going on in colleges and what students are learning and what the environments are about. So right now that there's a major shift, both within the federal government and in a number of foundations, to look more at what are the cultures, what are students learning. There's some question about whether or not there are going to be accountability measures tied to federal student loans, on whether or not kids learned anything in college. And if this comes about, I think that this will also have very interesting health implications, especially if we don't take into account preparation in high school. So I think that there are those people who can continue to do studies on the culture of colleges, but I also think that there's a very different conversation that has started about what's going on in the learning environments of colleges today.
Well, as a representative of the mother of all party schools, I'm going to shut this down now, and we can go to lunch. Bye.